Malaysia's medical cost inflation hit 15% in 2024 and is expected to increase as the population faces an aging nation, more chronic diseases, and advancements in medical technology. Now, with this in mind, how can employers ensure that the well-being of their workers remains at the forefront? Mun Kiat Ho from Mercer Marsh Benefits Malaysia shares the formula.
I need to know what is driving up the cost, the 15%. Now, if I know what is driving up the cost, then if I'm an employer, what can I control and what I cannot control, right? So like aging population, obviously it's very, very limited what we can do. Advancement in medical sciences is something that obviously we want, and obviously we cannot control the cost surge. So that boils down to then what can I then start controlling in terms of medical costs? So where we are helping our clients is to look at the cost mitigation from that point of view, understanding from your organizations what is driving up your cost in your organizations. What illnesses are we seeing? What demographics, where is it coming from? Is it coming from your employees at certain job levels? Is it coming from your dependents? Is it coming from outpatient? Is it coming from inpatient? So it's very important organizations start seeing where in the area is driving up costs from your side, because we know one area you are not able to control. But at least those areas you can control, then you start taking some mitigation strategies to control costs.
Besides gathering comprehensive data, Mun Kiat also warned of blanket solutions like cutting overall benefit plans. He suggests repositioning employee programs to focus on prevention and cultivating healthy habits to mitigate future rise in medical costs.
The last thing every organization wants to do is to cut benefits. This is seriously a taboo word, and this is something that we don't allude to as well, because we felt that benefits needs to be there, health benefits needs to be there because people do get sick. But what we want to do is obviously to look at how we look at overall healthcare benefits, to position it to more leaning towards health than leaning towards healthcare. I think that's also another area. So when we do a benefit design is how do we then start looking at trading off the benefits? Trading off is maybe I'm taking something, back from you, but I'm giving something meaningful to you. Instead of just cutting. Cutting is like I'm taking everything out from you. Trading is I'm giving you a choice. I'm giving a choice where if we take certain steps on your overall well-being, and that's usually leaning towards health, like prevention, like living better. I think is start looking at repositioning healthcare towards health, towards prevention, towards how you can pivot your benefit design towards productivity, towards increasing the awareness of well-being in your organizations.